Hi, and welcome to The Scoop. My guest today began her career as a medical practitioner in Burundi in the mid-1980s. As an infectious disease specialist, she spent several years as Associate Director and Acting Director of the HIV/AIDS program at the World Health Organization. As an Ethiopian national with an extensive career in public health, she is now the Director General of AMREF Health Africa that operates around the continent. Her fight against HIV/AIDS aims at solutions that can make lasting changes in African communities and the need for the international community to live up to its promises when it comes to supporting HIV/AIDS treatment and prevention in Africa. Dr. Teguest Guerma, welcome to The Scoop.
Thank you so
it's
much.
lovely to have you here. Thank you
It's
for
good to
making
be
the
with
time.
you too, Salim.
Teguest, a quarter of a century of healthcare. You've spent 26 years in healthcare. Where did this passion come from?
From my mother.
Okay.
You see, my mother wanted to become a nurse. And when she reached 10th grade, her father married her. And she has never been able to accomplish and achieve her dream.
Her father
So-
married her off, so your grandfather married her off to your dad?
Yes,
Yeah.
to my dad. And she promised herself that her daughters will become medical doctors. And she brainwashed us, I tell you. Every single day she will tell us about the good things about being a medical doctor, about health and everything. And we thought that was really something great. So 3 doctors in the family. Myself went to become a doctor. The next sister, she's now ophthalmologist, another sister, psychiatrist. And the fourth,
So your mom lived her dreams through you guys, completely.
exactly. And the fourth one said, it's enough for my mother. And she went and did something else. And that's
So what
how.
did she do? What did your youngest sister
The
do?
youngest one is now an IT network person. She works in Chicago.
Okay. But you grew up in Ethiopia.
Yes.
This was the time during Haile Selassie's reign. Then when did you leave and why did you leave?
I left 2 years before the change. Because I used to go to the French school. And at the end of the French school, we had this baccalaureate. And if you are successful and good, you are given a scholarship to France. So that's when I left. And when I left,
So you were successful and good. You got the scholarship.
yes,
Okay.
I
Where?
did.
Where to study? Where?
to study in Reims in France.
Okay.
My parents decided one thing, which was so important. They said, we will do everything, but we will not take out our children from private schools. Good education is what our investment in our children. And, they sold everything they had, but they kept my sisters and my brother in the private school. And myself, you see, after I went to France, I was supposed to be a medical doctor. But in France, after the second year, there is a quota that they reserve for French students. And they said I should be a dentist, but I cannot be a medical doctor, but I should be a dentist. Then I said, I don't want to be a dentist. I came here to become a medical doctor. Why would you want me to be a dentist?
This is after they changed your name as well. You were telling me earlier that it's Girma was Girma.
That was at the beginning, The first day at French school, instead of writing GI, they wrote it GU because, in French you cannot say, if you write GI, it becomes G.
Yeah.
But if you write GU, it becomes G. So to change it into Girma, they put the U. So they changed my name, but also they wanted to change what I wanted to be.
And you said no. So you left the school?
Let me tell you. First, I said no. I don't want to become a dentist. I went to our embassy in Paris, and I said I came here to become a medical doctor. I don't want to become a dentist. They tried. They couldn't do anything. And then they said, okay, if you don't want to become a dentist, then you can go to this technology school for 2 years, and then, they get rid of me. So I said, you do that and you go back home. I said, no, I came here to become a medical doctor. So I want to become, and they said, no. I said, then, in this case, write on a paper that I can become a medical doctor anywhere else in the world, but not in France. Okay, they wrote it. I went to the dean, and the dean wrote this. But then they stopped my scholarship. And you know, at that time,
So you're
my
stuck in
parents,
Rennes.
yeah, without scholarship,
yeah.
without anything.
Your parents
And
have
then-
sold all of
Yeah,
their
exactly,
assets.
you see, and that was a very difficult time. I didn't tell anything to my parents, because you see, I wanted also to learn life. I was that spoiled brat, you know, daughter of a general. But I wanted really to learn life. And I said, now my parents have done what they can. I have to do it myself. I interrupted my scholarship, so I have to find a way. And then I tried to register all over the world. And only 2 countries responded, Canada and Senegal. Canada, I needed $25,000 to go to Canada. But in Senegal, I could have a registration and go. Then I started to look for a job. And you know how difficult it was to get a job? And finally, I found a job of cleaner of the hospital. You know, I've never cleaned a house.
But you cleaned the hospital.
No, I have to clean a hospital, and I didn't even know how to do it.
Yeah.
I was this young girl, you know, very small, trying to clean, and of course I didn't do it well. And even the patients were feeling pity for me, and they will help me. And,
Helping you clean.
Yeah, and I had a very racist supervisor would
Yeah.
come and say, "What's done in this room?" And of course I would say, "It's me." Oh, but you know, there are many nounous and all kind of things around, because I didn't do it well, because I didn't know how to do it. And then the patients will say, "Oh, there's no elephant, it's only nounous." You know, they make joke out of it, and it was very hard. 3 days before I leave, one of a Senegalese friend who is married to an Ethiopian in France said, you're crazy, you're going to a country you don't even know anybody. Let me at least write a letter to my brother, that they can take care of you. I said, it's only 3 days left. I don't think they will receive the letter at that time. You know,
Yeah,
it
no emails.
It took a month
Yeah.
to get a letter. So forget it. He said, no, I'm going to write anyway. So I arrived at the airport. I didn't even ask about the weather. I arrived with this, you know,
Polo neck,
turtleneck.
yeah.
I arrived in Dakar. It's just like I went into oven. It was so hot. So I worked in the night. I worked to be a hostess somewhere. I worked to be anywhere, anything, any job I found, and pay my studies until I think fifth year of medicine, where one day I was at the airport, and because I was working as a hostess to you know, you get ministers, you translate French to English, and this is what I was trying to. I was helping with the Minister of Foreign Affairs, and the Foreign Affairs Minister came when I was found me when I was greeting the Ethiopian minister in Amharic, and then he said, "Do you also speak Amharic?" I said, "Yes, I'm Ethiopian." He said, "What are you doing here?" I said, "I'm studying." What are you studying? Medicine. I said, "Oh," and he didn't say anything at that time. And then later, he came back to me and said, "But is it practical for you to stay awake in the night like this and study medicine?" I said, "I have no choice. I have to do that because I have no scholarship." And he said, "Did you ask for it?" I said, "Yeah, but I'm not a Senegalese, so how can I even dream about having a scholarship?" And you know, that's another miracle. He called Chief of Cabinet, "Come. Monday, this girl will come to the office. You write a letter to her to get a scholarship from the higher education." I thought it would never happen, you know. I thought he was joking, but it did happen, and for nothing, you know. The Monday I went there, he gave the letter. I took the letter to the higher education, and I got a scholarship. That's why I always consider Senegal like my second
home.
country. Yeah.
We're going to come right
Yeah.
back with Dr. Teguest Guerma and talk about the next stage after university. Stay with me. Hi, welcome back. We're here with Dr. Teguest Guerma. Teguest, we were talking about, you mentioned your husband before we went into the break. He's not Ethiopian.
No,
Where is he from?
he's from Burundi.
And you met in university in Senegal.
Yeah.
How did he, he was studying medicine as well?
He was studying medicine with us, and he came in fourth year. When I went there in third year, he came in fourth year, and we, our names were G and H,
Okay.
so we were in the same group, and that's how.
That's how
I
you
think
met.
yes.
So moving from Senegal, so you finished, you went through the university, you
Specialities and,
did the specialities. You went back to moved to Burundi then. Was that again because of your husband's family ties that he had to go back?
Yeah, it's also because the Burundi University was just starting, and the dean of Dakar went to Burundi to inaugurate the university and negotiated for my husband and myself to become to go to
Professor.
the universities there.
So to become a professor
Yeah,
there,
well, not
yeah.
professor, but you see, assistant.
Okay.
Because to become a professor, you have to pass another exam again.
Okay.
But
good.
when
I'm
we
glad I
arrived
never
there,
went into medicine.
when we arrived there, they took my husband, and they didn't take me, because they said if the two of us work for the university, then we will get a lot of money.
Oh really? So that was basically that was what they were
basic
doing.
thing they said, And I remained for 2 months without a job after going through all this. And then one day I said, okay, my dream is gone. I cannot go to the university, but I will start from scratch in public health. And I went to the Ministry of Health and asked for a job. They first said, oh no, because it's the end of the year, we cannot give you a job. But then I'm always, I'm a fighter.
Persistent.
I'm a fighter.
Yeah.
So I went to the minister and then asked, I want a job. And the minister said, yeah, but we need medical doctors, so we need you. And then he gave me a job in the public health hospital called Prince Regent in Burundi. And then that's where HIV started. This was 1985. It was the first years where HIV came into picture, and I was the only infectious disease specialist. And everyone would be sent to me to announce death sentence because there was no treatment. And that
And
was
had you heard of HIV before
Yes.
this?
Yes,
Had
yes.
you studied it? Had you seen it?
Yes, in 81 when it happened in the US,
Yeah.
we had a professor in Dakar who had gone to the US and learned about it. So at that time it was not called HIV, it was called the immunodeficiency
Yeah.
syndrome. And he told us about it, but we had never seen one. So when we arrived in Burundi, my first patient came with all those symptoms that professor was talking about. And I said, is this really HIV? And that's how. And then, it was coming one after the other, one after the other. But at that time, as you know, it was taboo in Africa. The African governments didn't want to say that they had HIV.
So you would always have to say that the patient died from pneumonia or the patient died from...
I never accepted that.
You would put...
Yeah. I never accepted
AIDS
that,
on the
and
death certificate.
I knew that AIDS would become a big problem for Africa. So the director of the hospital would come and tell to all the other doctors to hide the cases, but he will never dare to come to me because I would say no. I said no. Well, I would tell and show everyone what's happening. And we established a committee with all the foreign doctors and some Burundian doctors. And we were at that time already doing prevention, using our own money, going into the hills and really talking about AIDS. But the government was not happy with this. And those university teachers, who didn't want me in the university, now they started to be very jealous. And then, because, oh, shit, they're getting money, this. And then at a certain time, they gave the data that we were keeping with a Belgian doctor to a magazine. And that magazine came out with a caricature which showed the Director General of Health Services of Burundi, saying there is no AIDS in Burundi, and close to that, all the
All the
numbers.
information, yeah.
Of course, that Belgian guy who used to work with me was persona non grata, 24 hours.
Deported.
Yeah, and security came to my office, broke everything, took all the documents. I tell you, I was in trouble for many months. I thought I was going to prison or anything. But, and then the worst thing was that we would see patients dying like flies, but we would do nothing. So I couldn't bear with that. I couldn't bear with that. And then I decided I cannot continue to work here. So there was a very important choice that I had to make. To leave my children, my younger one, I have two children.
How
and
old
my,
were they?
my younger one was 3 months old.
3 months old. Wow.
So that was a very
So
difficult
you
decision.
left when
And I
was it
left
a boy or
her,
a girl?
a girl.
Yeah.
I left her when she was 3 months old to go and get a job and take her later, you know. And I thought this would be a few months.
And where did
But
you go?
First I went to Ethiopia and started now going from up and downs from Ethiopia to Geneva. And I went all over Africa to do the medium-term plan for HIV/AIDS for all the countries. That's where I went everywhere. It took 6 months to see my children again, to get a permanent job in WHO. I thought my daughter had forgotten me, but one thing I used to do was to send recorded, tapes with my voice talking to my children. And I will also buy everything, because material doesn't replace love. So I will buy everything, but that's not the most important thing. But my young daughter, when I met her 6 months after, recognizes me because of my voice and my smell. You see? And that was the most emotional time for me, because I thought she had forgotten me, but she didn't.
That must have been the hardest thing to do, is to leave young children.
Harder thing to do. But you see, you have to take a risk. You have to take a risk. It was worth it.
It was worth it. Looking back now, you can say
it was worth it. If I didn't go out of that place, I would have been in a big trouble. You know what happened in Burundi, and also my husband died afterwards. So
I'm sorry, what happened?
He died. He had cancer, so he died.
Okay.
Yeah.
And how old were your kids then? And where were you when it happened? Were you with him, or were you out of the country?
I was in Brazzaville working for WHO, and he died with me in Brazzaville, but we knew about it a few years ago. But before he died, he said he would do two things. He will become a professor, because, he was on that way.
Exactly.
And he will also leave something for his children. He was a very courageous man, and he did that.
We're going to come right back with Dr. Teguest Guerma. Hi, welcome back. I'm here with Dr. Teguest Guerma. Teguest, we were talking about favorite place that you've practiced in or worked in or visited.
Two countries where I lived in and that I really love. Botswana, where I really convinced the government to take HIV/AIDS as a priority when they were not considering it when I arrived there. And I worked there as a WHO representative, and I was able to mobilize the UN to convince the President Mugabe, who has become an AIDS advocate afterwards.
Absolutely. I mean, Botswana has done amazing things with
I
controlling HIV.
It was not like this.
Yeah.
When I arrived there, it was not like this. And we managed, together with the Minister of Health, Joy Pumapi, who has been, we managed to really change the face of HIV/AIDS in Botswana. But I also like Botswana because there is real leadership there. The presidents can go anywhere with the people, They can be invited in a wedding. You wouldn't know who is president, who is not president. They talk with everyone. There is really real democracy.
So it's not that big man syndrome, that's there. Tell me a little bit. I mean, AMREF is the oldest NGO, African NGO, on the continent. Just celebrated 50 years. So it's been operating over half a century. best known perhaps for the flying doctor services, but AMREF does much more than that. Tell me a little bit about the challenges you faced here and also the expansion plans of AMREF.
AMREF, as you know, is a leading international organization in Africa. Was established since 1957, 55 years now. What we try to be is really to have a lasting health change in Africa. We don't want to tackle the symptoms of the health problems in Africa. We want to go and solve the real problems of Africa. That's why we think that to do that, we need to empower the communities. We need to go to the communities. We need to get respect and empower them, give them the skills and the means for them to transform from within and change their health in a lasting manner. You know, AMREF, for example, has managed to change the cultures of the most communities, Maasai communities in Kenya, by having the passage of right without female genital mutilation. You see, they will do all the initiation, but they will not do the cutting. This is one small part of AMREF, but we also train. We have an international training center in Nairobi where we train mid-level health workers to fill the gap of health workers in Africa. So we really cover a broad area of health development in Africa. And of course, we would like to strengthen the system to tackle the root cause of the African health problem.
After all these years, you know, you're slow. At some point, you're going to retire. Although I don't ever see you actually retiring, because I think you're far too passionate about this. When you leave AMREF,
Soon, you know.
well, hopefully not so soon, because I think AMREF does need you. But when you leave AMREF, what's next for you in terms of? I mean, your kids now. You were telling me earlier in the break, your kids are now, you know, in Canada. They've graduated. Your son's become a dentist. Fantastic irony.
My daughter.
Oh, sorry, your daughter's become a dentist. Fantastic irony that one of them has followed the path that her mother refused to follow. Would you like them to come to Africa? Do you see a healthy Africa in your lifetime?
No.
And where do you go from here?
I wish they will. And I am encouraging both of them to come back, especially the younger one. Maybe he will come back. Yes, I will be retiring, in fact, very soon, in a few months. But I will never stop. I will retire, but I'm not tired, as you know. So I have a plan of going back to Ethiopia and opening a social enterprise, a nurse midwife school, which will become a social enterprise and can empower girls in the rural areas.
If you had a chance to do it all again, would you change anything? Are there any regrets?
I had everything I wanted in my life, including coming back to Africa and serve Africa at the end of my career. I don't think so. I took the risk. At all steps of my life, I took the risk. And this is what I want every girl, woman in Africa to do, to take the risk. The sky is the limit. To be ambitious and to go forward and catch what is up there. I think it is important. And I've done that all my life. And I think I've got everything I wanted.
The show is called The Scoop. Tell me something about you that nobody else knows, preferably. Maybe one or two people, but preferably nobody else knows.
You know that I'm a survivor.
That I've gathered from this interview. 100%.
I almost died the day I was born. I was a big baby. You know, it was in the 50s in Ethiopia. They tried to get me out by all means and didn't work, but they infected me, and my mother got a C-section and she delivered. But then I had this neonatal infection. And everybody said, let her die if her mother survived. And I was left there to die. But I survived. And I survived all my life, you know. Many challenges, many struggles, but I survived. And that's going to be the title of my next book.
And that's The Scoop with Dr. Teguest Guerma. Join me again next week when I'll be talking to yet another great African personality. From me and the entire team of The Scoop here in Nairobi, Kenya, thanks for watching. Teguest, thank you so much.
Thank you so much.
Really appreciate it. Thank you for coming. It was a fascinating conversation. Fascinating.